no, the
Cardio.
the muscles of your eyes. Okay, so you are going to say, you have to look straight. Okay, do not move your head, you just follow my fingers, and you are going to say, all the way, all the way. Okay.
So you make like an asterisk?
Yeah, mine is asterisk. Others, they want the H, but I'm more comfortable in the pokes or the asterisk.
And
Okay.
that's for that covers the 3, 4, and the 6.
Yes, because your extraocular muscles are the muscles of your eyes. Those muscles are the ones that allow you to move your eye to go up, out, and these cranial nerves are the nerves that innervate your muscles, like your oblique muscles, your superior muscles, your inferior, and your superior muscles of the eyes. These are the things. So when you do that, you are testing this one. Okay, and now I am going to assess you by confrontation or your peripheral vision. Okay, the same. You are going to look my eye. Do not move your head. You are just going to say, now if you see my fingers coming to your vision, I would like you to cover your eye, and I'm covering my eye, and then there are 4 points. Superior, you say now, okay, when you see it.
No.
Okay,
No. No. No.
okay.
So there's 3 points: superior,
4,
4.
superior, temporal,
temporal,
nasal, and
Nasal,
inferior.
and inferior.
All right, now, Professor, I can see your hand all the way up. Yeah, because your peripheral vision and my peripheral vision are inside. There are patients that may not be able to see your hand until you are almost in line with their central vision. Okay, so that is your,
Just to make sure you want us to do the kinetic one, right?
yes.
So not static.
Perla, cranial nerve 3 by Perla. What do you need? Your pen light again. Okay, I'm going to dim the lights. Okay, that's critical. I want you to say that. Dim the light.
But we're not really.
No, you are.
You are. The switch is over there.
Okay.
Dim the light. Okay, because
Okay.
this one will give you some light even if this is close. Okay. All right. Now I'm going to. This is the critical that I would like your pen light to be coming from the side.
From the
Okay?
side.
This is your direct. Okay. When you do like that, I'm assessing her left pupil, and I say that the left pupil is round, and approximately your pen light should have your approximate gauge or sizes, approximately 2. And I see that when I put my light, it dilates and constrict briskly. That's the word, briskly.
Briskly.
Now, why do we have that? Because there are patients whose movement or constriction or dilation of the pupil may be sluggish. Patients with traumatic brain injury, post-neuro patients. Okay, 2 to 3. All right. I'm going to go to the other side. You always come from the side. Now I'm looking at her right eye, correct? Right eye. So that is his pupil. Right pupil is also round and about 2 to 3, and what? It's brisk. Now, why do we have to check one eye at a time to see if they are equal? That is why you write equal, because the pupils are equal. Now, there are patients whose pupils may not be equal. So in that case, you are not going to write Perla. All right? So pupils equal round and reactive to light. It reacts. How did it react? By dilation and constriction. How fast? Brisk or sluggish? So I say briskly. That's your pearl. Perrl. Now the A is what? Accommodation. Okay, can you look for behind me? Look behind me, okay? And I am going to ask you to shift your gaze to my pen. Okay, what did you see?
Both of the eyes come with the other one.
Okay, so you have convergence and constriction. So you're done with your Perla, accommodation. Okay, next is I am now going to check your nose.
So we turn the lights back on.
Yes,
Okay.
if you can see with like this, then you can. All right, I'm going to check your nose. Okay, inspection, I'm just looking at the nose. So I'm looking, it's at the middle. There is no deviation. There is no redness. Okay.
Mm-hmm.
There is no discharge, nasal discharge coming. So I'm done with that. Did I do isolation? No, I didn't. Okay. Now I'm going to palpate. I'm going to palpate your nose. Okay. The bridge of the nose. I
So
don't.
just
I don't
okay.
feel. Yeah. You just palpate. What else can you
I
do?
was just wondering if there's any like landmarks. No, just the bridge. Okay.
And you are going to feel for what? If there is any tenderness, or if there is other bony prominences that is there. If the patient will say, oh, that's sore. Okay. Now I'm going to check your nasal patency. Okay. I'm going to occlude one of your nostril, and now you sniff for me. Okay. And then the other one. All right. Okay. Now you go for your
Ears.
ears. All right. So I look again. What do I'm looking at? What I'm inspecting? The normal size. Okay. And they are equal. And do I see any discharges coming out of the ears? I don't see any. Are there any lesions? Like some patients may have gouty lesions in here, right? I don't see any. Now I'm going to touch your ears. I'm going to palpate, okay, touch. And then I'm going to do my thumb and my 2 fingers and press the pinna, okay? And then the tragus. I don't see any, any tenderness, or the patient is not having any pain. Now, for this, if your time is already fast approaching, you can do only one ear because we have seen how you do it. Well, about assessing cranial nerve 9, motor only, what do we say? We need your, what do we do? Pen lights and the tongue depressor, and ask the patient to say, and I look, what am I looking at? I look at the uvula, that it is midline and it rises with the palate. And then since I'm looking at the oral cavity, I'm going to say that the tonsils and the posterior pharynx are pink. All right? Ding, 5 minutes done. Then you go to the next one. Oh, tongue movements. Oh, now, if you are going to say, oh, I'm done, and then you look, oh, I have not done that tongue movement. Okay, last, tongue movements. Okay, can you stick your tongue out for me, please? Okay, move up. Lift your tongue up, okay? Put your tongue to the side, okay, stick it out again, raise it up, trying to nose, and
You're
yes,
not
all
good
right.
at
So then I look at it, and I did this, and bling, done. Okay, now you go out, okay? The rater will say that 5 minutes over.